going with that confidence is you have to know, are you prepared? And do you know the material? Okay. And understanding how significant this test is. The test is significant for you guys because if you don't pass it, you don't have a job. At the end of the day, that's what it comes down to. Do you want a job? And how bad do you want a job? Okay. What is the worst thing? What is the absolute worst thing that can happen? You fail, right? You fail a test. Somebody can die later. But is anybody going to kill you? Like, is anybody like holding a gun to your head saying that if you don't pass, you're going to die?
That might help.
Yes? Kill people? All right. So, now.
Yeah, this is Georgia, so someone can do that for you.
Absolutely.
In the back of the room and just
We know some people.
You know some GI guys.
That's right. Now, so the worst thing that can happen is death. All right, there we go. So, but everything beyond that, everything before that, that's a plus, right? So if I go in there and I fail it and I manage to leave the test and I'm still breathing, I'm calling that a win, okay? Because you can go through and you can retest it because you have three initial attempts to take this test. And then you have to take a refresher course, which 24, 36 hours, depending on which one it is. And then you have 3 more additional attempts. And if you fail after your 6th attempt, okay, you have to retake the entire course. If it's the basic portion, you have to retake the basic portion. If you have to take the advanced portion, then you're just taking that 2-month long advanced portion. So that's the worst thing that can happen after you fail 6 times. There we go. Okay, cool. All right, so psychologically prepare yourself. All right, you need to know that if you click A, you are 100% correct that that answer is A. Okay, because if you go into a test and you say, you know what do I need to make? I need to make an A, or I need to make a B. 80% is passing. The 70% is passing on my unit exam. If you go in thinking that you're gonna make a 70%, well, you're already setting yourself up for failure. Okay, because if getting a 70 is important whenever you need an 80, you only missed it by 10%. So if you would have tried 10% harder, if you would have done 10% more, maybe you would have passed. If you go in and you know that you gave it 100% of everything it is that you have, and you come up short, you come up with that 80 still, well, you still gave it 100% of everything you had, you know that you gave it your effort. And you also know that you still passed. But if you go in shooting for 80 and you miss that by 20%, you're still failing. Does that make sense? Okay, so always shoot and make sure that you go in 100% of every question that you answer. You need to be certain. And you know as much as you know right before the test. Like I said, there's not going to be anything that you're going to do right there before that test that is going to make a difference. You looking at that last note card is not going to make a difference. And whatever's going to happen is that's just what it is. Okay, and be realistic with yourself. Okay, if you go into the test and you know that you didn't study, and you go into the test and you know that you didn't study OB, you studied everything else, but you never made time for OB. You get to that OB question, you still need to give it your best effort. But if you see something and you don't know it, why don't you know it? Okay, and you don't know it because you don't study it.
A lot of people like to lie to themselves,
right?
Or think that they are expected to be given the credit for the answer just because they are there.
Yeah, just because you attempted it does not mean you're going to get it.
Nope.
Okay, and that's why what I was saying earlier about testing, about studying. Do you study what you know, or do you study what you don't know? You study what you don't know, because if you study what you know, you're going to be really, really, really good at one thing and one thing alone, and that's not good. That's not beneficial to nobody. Okay. So does anybody ever who gets like extremely stressed? A couple folks. Okay. So like I'm talking like borderline panic a little bit.
Can you take a test?
Just in general.
So there's a couple different things you can do. Okay. So breathing exercises. All right. So whenever you start getting agitated, whenever you start getting stressed, a lot of time your respiratory rate's going to pick up a little bit. You're going to go. Maybe not necessarily that dramatically, okay? But unless it's true, okay? And if that's the case, you need to be able to recognize that about yourself, okay? You need to be able to recognize that you're actually getting to that mental state, because you guys remember that stress arousal color code that I was talking about earlier? Okay? Whenever you start finding yourself a condition red and condition gray, those are issues. You need to do something to kind of wind yourself back. And that's what this is, the breathing exercises. So slow down your breathing. Take a real deep breath in through your nose, out through your mouth, or in through your mouth, out through your nose. I don't care, whatever it is that it makes you feel better about yourself, but understand that there are breathing exercises that you can do. Sometimes I have to do that. Whenever I'm in a stressful situation at work, sometimes I go in there and I'm like, okay, and I'm looking at it and I'm saying, oh, this is a lot. And then I go, take one deep breath in, I let it out, and then I go to work. Does that make sense?
Structure fire. I do the same thing.
Right.
I have to get my mind right.
And this is that mental relaxation that you're providing yourself. So there's also something called muscle relaxation, which is pretty much where you tense up muscles. So everybody do me a favor. All right. Like, we've all been to the gym, or we've all lifted something to a point where our muscles hurt, right? Maybe?
Yes.
Okay, cool. All right, so now what happens?
Your expectations are unrealistic.
They are. I realized that right after I said that. So now, if you've ever lifted anything to a point where like your muscles are really, really sore, what happens as soon as you let it down? What do you feel? You feel relief, right? Because now I'm not carrying the sandbag. I'm not carrying this bag at all. And now my muscles there, they've released. They're like, oh God, yes, thank you. Okay, that's a good thing. So there's this thing called muscle relaxation, where you take your muscles and you tense them up. Okay, so like you're sitting here, you're super close to yourself, and you just tense up all your muscles. You tense up your biceps, you tense up your arms, you tense up your chest, your back, everything. You just hold it in. Okay, and you're holding it, and you're holding it, and you're holding it, and then you just let it go. And then whenever you let it go, what happens is you feel this wave of relief actually from your muscles, and it's going to start releasing things, those feel-good things, those feel-good chemicals. And whenever it releases those feel-good chemicals, it's going to make you feel good. Okay, and if you're in the middle of a test and you're like, oh God, I'm getting super stressed out, and then you tense up, you squeeze up, and you just let it go, just let that stress out with it. And so self-relaxation, hypnosis, I know somebody that did hypnosis and it worked. And I'm talking about like before they went to the test, they went to, I don't know like the exact things behind it. I know that hypnosis is supposedly a thing. Yes.
All stage hypnosis and real therapeutic hypnosis, two different things.
Okay.
What they do in hypnosis for test anxiety, if anybody needs it or requires it, basically all they do is they put you during the hypnotic work in session, they put you in an extremely relaxed and extremely confident mindset, and then they create a trigger. It's not as obvious as clapping your hands and all of a sudden you start walking around like a chicken. But there is physical anchors that we do and teach you so that when you get in there, maybe you just do this. And because they've conditioned you over several sessions, you instantly calm, cool, and you go to that happy place. It does work as long as you want it to work and you're open to it.
Right.
You cannot hypnotize someone who does not want to be hypnotized. Hypnosis is just deep suggestion and physical anchoring. It does work. I've got a therapist friend of mine that teaches at the university. He's done it to me. It does work if you want it to work. If you do not want it to work, it will. But if you have real severe test anxiety, it's actually a good option.
And I feel like that the anchoring and everything, it kind of goes back to what I was talking about the chewing the gum. And you're conditioning yourself for it.
I'll give you another common example of physical anchoring like that. Let's say you have someone super close pass away to you. And at the funeral, everybody that walks in, for guys, they shake your hand and do that man hug where they just reach around and pat you on the shoulder. Well, you go through that 70 times at a funeral where you're in that deep emotional mindset. 6 months later, somebody walks up and shakes your hand the exact same way. You won't relate it, but you'll all of a sudden feel down and depressed. Mm-hmm. It's because that anchor took you back to that moment. You can actually do this at home if you want. Find a state find a time and a place where you're relaxed and confident and comfortable with yourself, and just do anything. It could be flicking your thumb or tapping on the back of the hand or any kind of just tapping your knee, any kind of physical touch or anchor that ties you to that mindset. The more you do it, the stronger that anchor will be, so that when you go and use it in the field, you can even use it in the field if you're on a bad call, because I don't care how long you do this. I mean, I still did it when I retired, even on bad fires. all the rush of the quick dress, get in the truck, make sure we got everything going, doing your OODA loop, doing all this kind of stuff. And then like a minute or two before I get there, I go, okay. Because I didn't want to go into that fire in that big rush of being pissed off at dispatch and not trying to get the right trucks to where they need to be. And you're short man because your third man's out sick today, so you know, blah, blah, blah. You got all that. But that critical thinking ability is most important when you get in the middle of that scene. So create that anchor. How many of you have seen the movie Shallow Hal?
Yes. Well,
You remember the elevator scene with Anthony Robbins where he's having Hal say, tell me of a time where you just felt the most love and you just did this, and you did this. Yeah, close your eyes and describe it to me. And in the middle of it, he goes, demons be gone. What he was doing is creating a physical anchor that by being startled all of a sudden, Hal would go back to that place. Same kind of thing in this.
So it is a real
Sorry,
thing.
this
It does work.
that area.
No, that's okay. No, I'm glad. I'm glad. Now, yes.
exactly that.
Here's your unit exam. That's the scare. All right, so you have to prepare yourself academically by managing your material, managing what it is that you do know, managing what it is that you don't know, and setting out timelines like what we talked about earlier about setting your test date 18 days out. You allow yourself to study each additional thing. Okay, and you have to prepare yourself physically and psychologically. And if you do this and you take care of yourself, and you take care of yourself mentally, you take care of yourself physically, you eat. Okay, that's a big thing. Positive things are going to start to happen. Okay, positive things happen to positive people. Negative things also happen to positive people. But positive people look at those negative things and it doesn't drag them down. Does that make sense? But negative people have positive things happen to them. But negative people also have negative things happen to them. Whenever those negative things happen, it just drags them down. And that's that mindset that they're in. So if you get yourself in a positive mindset versus a negative mindset, you're going to start noticing some differences. Now, you have to know what the question is asking you. Okay? And that is going to be the most important thing about the entire thing. You have to know the information. You have to be able to tell that information, but you also have to be able to tell what is the question actually asking you. And so you have to be able to mark the distractors. And the way that you're going to do that is you have to know the nature of illness or the mechanism of injury and look for differentials. Okay, so essentially something that you think is going to happen, like your blood sugar, your blood pressure, your respiratory rate, your heart rate. Look at those things and kind of be able to tell what's going on. And those vital signs are going to guide your treatment priorities. Right? So if you have somebody with a blood pressure of 72/30, what's your treatment priority? Fluids, right? Okay. Now, and we're going to talk a little bit more about that. But if that's all it gives you, my treatment priority is going to be fluids because that is not a sustainable blood pressure. That is not a sustainable map. Now, and mark through the answers that contradict themselves. Okay, such as, for example, if you have a question that says 1 breath every 2 seconds, is that ever adequate? What if I suction continuously for 2 minutes? Is that ever adequate? No. So we know that those answers are automatically out right off the bat. Okay. So knowing what the question is asking you, you have to look at these key terms, all right? So you have the key term, you have most important, most suspicious, most suggestive, and most correct. Okay, each one of these things can be a different thing. So which one of these findings is most important? The respiratory rate is non-existent. The respiratory rate is 6 and labored and shallow. Okay, that's the most important thing because they're about to die. Okay, based off these clinical manifestations, you should be most suspicious of an opiate overdose. These vital signs are most suggestive of somebody being hypotensive. And out of these, what is the most correct? Okay, because it's going to have suction. It's going to have assist ventilations. It's going to have established IV access with 20 milliliter per kilogram fluid bolus. And it's also going to have maintained C-spine. So which one's most correct? But if trauma, maintained C-spine, that's really high up there on the trauma list, right? But if there's no trauma indicated, is that necessary? Does that make sense? So and you have to be able to look at those key terms. Now, should is a very, very big one. Okay, because if it says what should you do, all right, so you should do this. What is that asking you?
Say that again.
All right, so if it says you should, what is the question asking you? So if it gives you this information and it says you should, what do you guys think it's asking?
Something you should do given the situation.
Something you should do given the situation.
It's not specific though.
And your training.
You can only do what you're trained to do.
You can only do what you're trained to do. So if you're taking the basic test, it says you should, and one of the answers is 20 milliliters per kilogram fluid boluses. Is that the right answer?
That may be something that should be done, but it's not something you should do.
Correct. Now, there's going to be times where you may see something that says intubation or supraglottic airways or needle decompression. So you should, can you do any of those things as a basic or as an advanced? Okay. Now, what should be done first? That's going to be, what should be done first? That's going to fall first in your list of priorities. Okay, so we should all know our trauma sheet, right? So so it's broken down into 12 steps. And I'm going to lay those out for you here in just a minute. But those first 5 steps, BSIs, machine safe, mechanism of injury, number of patients, additional resources, C-spine. If any of those is your answer, with C-spine, obviously if there's trauma indicated. Okay, but so those 5 steps, if any of those isn't answered, that's going to be what should be done first. Does that make sense? And then you get into your general impression, your level of consciousness, your life threats, massive hemorrhage, airway, respirations, your circulation, hypothermia. Okay, and then your treatment and transport. It's going to fall in that list. What should be done first? Now, what is the treatment priority? What is the treatment priority of somebody with a tension pneumothorax? Needle decompression. Does that make sense? Can you do that though? But could that be your answer if that's what it's asking you? Because I can paint out this entire picture. I can paint out a picture of you respond to a gunshot, you find a male 22 years old, unconscious, unresponsive, initial GCS of 5. He is breathing 32 times a minute and shallow. He has diminished breath sounds on the right side. He has diminished breath sounds on the right side. His airway is clear. His blood pressure is this. Pulse is this. What should be done first? Based off that, what would you guys say is pretty high something that should be done pretty quickly? Airway and breathing, right? Okay, so open his airway, insert an OPA, or insert an NPA as long as there's no facial trauma. And that should be one of the first things that should be done. But now if it says what is the treatment priority for that exact same patient, is an OPA going to fix him? Is an NPA going to fix him? Is a BVM? What is going to fix him? Needle decompression. So that's what you got. See the word first, you have to look at your patient presentation. Whenever it says first, and that is going to be what is an immediate life threat. Okay? Start with the massive hemorrhage, the massive bleed, and then you go into your airway. So what's going to kill somebody quicker and what's going to have the most negative effect? What is going to kill your patient right now? Is it the fact that they have blood spurting out of their right arm? That's pretty important because I can replace oxygen. I can replace air. Can I replace blood in the field? No. Okay? At least not now. Maybe in like 20 years. But what's the immediate life threat? An order of priorities. Your order of priorities, your trauma sheet, your medical sheet, those first 12 steps are exactly the same every single time without fail. Okay? And it's always the exact same way. So, based off those order of priorities, whatever comes highest, that's what you have to do first. All right? And so I'm going to draw this out for you guys. If you have it gets in everybody's way up there, yeah. If you have, well, maybe now that Jordan's gone. So if you have a scenario, if you have a scenario-based question and it's asking you a lot of information, it's giving you a lot of pieces, okay? This is what I do whenever I take my test. I know that my very first step is going to be BSI scene safe. And then I have my mechanism of injury / nature of illness, number of patients, additional resources, and then C-spine. This is all part of the scene survey, right? We all know this, right? Okay, so next thing is, what is the very next step that you have to do?
General impression.
General impression. What do you see as you walk up? Okay, and after that,
Call out LOCs. After.
level of consciousness. That's going to be your AFPU. So are they alert, verbal, painful, or unresponsive? Okay, what's after that?
Chief complaint.
Chief complaint / life threats. Okay, and the way you treat your life threats is what is going to kill them right now, starting with that massive hemorrhage. Okay, and then from that point, you get into your airway, your breathing, your circulation, and then you got your treatment and transport. Transport. Okay, now, so every single time I go to take a test, every single time, I write this out. Okay, I write this out on my scratch sheet of paper. I write this out somewhere. Okay, and next to it, I have a whole bunch of lines.
Check it out.
And check it off. So, what I know is that if I have a question and it says, what should be done first? Okay, and so it's a trauma call. You're called out for an MVC, possible ejection. Your patient was unrestrained. They're not alert. They have a blood pressure of 62/40. Their mouth is filled with blood and vomitus. They're breathing 6 times a minute and shallow and irregular. And their pupils are unequal. What should you do first? That's what it's asking you. Okay? So from that point, that is where this comes in. That is where this comes in, because who made this sheet in this order?
Registry.
Registry. Now, what test are you taking?
Registry.
Registry.
Whoa.
This is the law. Okay. So your very first answer, A. A says transport to a trauma center. Where is that at on here? It's the very last thing. So it's right there. Okay. B. B says insert an OPA and assist ventilations. Where's that? So that'd be right here. So we'll kind of put it on the in-between because it kind of covers both, right? Okay, now, so your next one, it says call for additional resources. Okay, and then your next one says control the arterial bleed.
Life threats.
It's life threats, right? So, and that's right.
The question is, what should we do first?
What should you do first? What you should do first is you should call for additional resources. Do you need to control that massive bleed? Do you need to control his airway? But what you need to do first is call for help and make sure that you have what you need every single time.
Do people get tripped up because they painted this whole picture and in it that says they have this massive bleed, so they're freaking out about the bleed, so that's the first thing they
They
look
get
at.
Correct.
tunnel vision.
Correct.
Instead of looking
And
at
see,
the
and
whole
so
picture.
correct. And so because they'll look at A, they'll look at B, so they'll be like, A, oh, that's pretty far back. B, all right, and it says suction and BVM. And that's what they'll go with. They'll never get to D, they'll never get to C. Just because, you know, you look at it because you read the question and you're like, oh, I already know the answer is suction. Does that make sense?
You have to read the question and all of it.
Read the question and all the answers.
Where are my brainiacs in here?
That one right there.
Obviously. If you're a brainiac, you will read crap into that question quicker than anybody else in the world.
Yes.
The best people that are people that are either comfortable, but not so over smart they overthink it.
Mm-hmm.
Or to be honest with you, I hate to say it, the really dumbest ones who have just the basic core knowledge because they don't read into the question also. I no lie, I had a class for a student that I would have never have thought could have passed registry, aced it on the very first time.
Yep.
He even called me up going on and on. Man, I only had 75 questions. It was great. And I'm like, oh, you crashed. Passed. My best student out of that class had to take it 3 times to pass.
Because they overthink. They're so smart that
They overthought the first
Yeah.
time, read into the questions. Second time they went in there, decided they're just going to be a dumb old fireman. And failed the snot out of it then. It was only on his 3rd time. We took it 3 times. 3rd time was when he found that middle ground of applying the knowledge and scope of practice, but not overthinking or reading into the question.
Absolutely.
Sorry, Jeremy.
That's okay. You have to take it at face value. Don't read into any of the questions. And you have to know your order of priorities, which is this exact sheet that's behind me. And I promise you, if you know this sheet, if you write this down and it says, what should you do first? And you put A, B, C, D along here on the side, you will get it right 100% of the time without fail. I can promise you that. Okay?
People make both of them, guys.
Yes. Now, you have to know the mechanism of injury, and you have to look at the vital signs and the treatment priorities, because if it says, what should you do first, and it's not up here, it says something like, it says something along the lines of dress the abrasions, and it says manage the avulsion, or cover the evisceration, or rapid transport. Well, rapid transport is going to be your answer, all right? And so you have to know your treatment priorities, okay? Because nowhere up here do I treat eviscerations because they're not a life threat. Nowhere up here am I dressing any injuries if it's not a massive bleed. Does that make sense? So, so again, it's not always within your scope. If you see most important, because if it's most important, what is the most important treatment for this patient? For somebody who's presenting with muffled heart tones, jugular vein distension, and narrowing pulse pressure, what do they have? Cardiac tamponade. What is the most important treatment for this patient? Pericardial right? Or surgery. Now, is that within your scope of practice? Okay. But is that going to be the most important thing for that patient to get? Does that make sense? Okay.
Would that still be the answer?
That would still be the answer. Because it doesn't say most important for you, it says most important in general.
Is it just testing our knowledge?
It is testing your knowledge. Because you need to know your job and the job of the person above you. Because you need to be aware of what a paramedic can do. Do you need to wait 10 minutes for the paramedic to get there, or do you need to go ahead and drive 15 minutes to the hospital? You need to be able to make that decision. Does that make sense? Because is a paramedic in the state, paramedic does have the ability to do pericardial centesis as far as the national scope goes, but you cannot do that in the state of Georgia. Does that make sense? So you need to be aware. You don't necessarily have to know the policies and procedures behind it all, but you need to be aware of these things.
It doesn't make sense, but I understand it.
Yes,
Nationally, okay, but not in Georgia.
correct.
It doesn't make sense, I understand it.
Yes. Now, so let's look at this. We have a 70-year-old male patient has a history of type 1 diabetes and COPD. Your patient is complaining of severe abdominal pain with a tearing sensation. His vital signs are as follows. Pulse is 130, respirations are 18, blood pressure is 90/52, SpO2 97%. You should be most suspicious for. Now, before we do that, we have to know the very first thing, what is the question asking us? What you're suspicious of. Okay, so now we're going to take this information and we're going to mark through all the distractors. So diabetes and COPD.
Told you what those are.
Correct. So I have a 70-year-old male patient. Do I care about history of type 1 diabetes and COPD?
No.
Throw it out. He's complaining of severe abdominal pain. Is that important?
Yes.
Tearing sensation. Is that important?
Yes.
Pulse 130. Is that important?
Yeah.
Respirations 18. Do I care?
No.
No. Blood pressure is 90/52. That's low. O2 is 97. Right? So that's good. So I have a 70-year-old with severe abdominal pain and a tearing sensation. Pulse is 130, blood pressure is 90/52. What do you think? AAA. There you go. And you guys see how I cut this entire paragraph down to a sentence. Does that make sense? To 3 things. You have to do this with every single question. If you do this with every single question, and you said, what should you be most suspicious for? AAA. Everybody got that. But now here's the thing. So if I give you this exact same question, and I said, what are your treatment priorities? Rapid transport. Okay?
Jeremy, can you use the dry erase marker to mark through those things?
We're
on
very
the screen?
visual.
No, I'm talking about the testing stations.
Maybe.
I would always take like.
Maybe.
one piece of paper.
Probably not.
I would always just jot down the important things.
Yeah. So yes, you can do that. But, and you can also rewrite it out. That is a true story. Do I?
Take that little piece of paper
And just come.
how often,
Yeah.
my thing is I would jump between the first sentence of the question and jump to the answer and go back to the question and go to an answer.
Mhm.
Cover up those answers, read the question,
Yep.
read it again, read it a third time. What's this question really asking? What's pertinent? Yeah.
Yes, absolutely. Now, so you guys remember what I was talking about earlier about you getting the same information and getting asked a different question? That's what they're going to do. They're going to say most important, most suspicious of, and then 20 questions later, you're going to get the same exact material, except that last thing, what the question is asking you, is going to be different. Does that make sense? So whenever it says, what is the question asking you? I'm not asking about all this. I'm asking, what is the question actually asking? What should you be most suspicious for? What is this most suggestive of? What should you do first? All of these are important except. Does that make sense? Okay. Now, practice makes perfect. If you practice this over and over and over again, you'll get better at it. Now, so can you guys read this all the way there and back? Kind of, sort of? Okay, cool. So I'm going to read it out loud. All right? And I do not want anybody to look at any of these answers. Screw the answers. Okay, so now, you're dispatched during the night to a 55-year-old male patient with an altered level of consciousness. Police officers on scene state that your patient was assaulted during a domestic dispute. You find your patient unresponsive, lying supine on the ground. Your assessment findings include blood pressure 170/100, pulse is 50, respiration 24 and shallow. Treatment priorities for this patient should include. Now, what is the question asking us? Treatment priorities, which is essentially another way of saying what? What comes first? Now, when it says what comes first, what do you need to be going off of? This sheet up here. Does that make sense? Okay, so while we're doing this, I'm going to go ahead and I'm going to take this out. Okay, and we're going to do this one together. So, but before we do that, we have to be able to mark through the distractors. Okay, so let's read this question again and tell me what's relevant. You're dispatched during the night to a 55-year-old male patient with an altered level of consciousness. What's important? 55-year-old male, altered level of consciousness. Police officers on scene state that your patient was assaulted during a domestic dispute. 55-year-old, altered level of consciousness, assault. He is unresponsive, lying supine. Blood pressure is 170/100. Do I need to worry about that right now?
Stable.
Okay. Pulse is 50. Do I need to worry about that right now? Okay, I need to be aware this thing is a little low. Okay. Now respiration is 24 and shallow. Do I need to worry about that? Treatment priorities for the patient should include. So if I reread this again, dispatched 55-year-old male, altered level of consciousness, assaulted. He's unresponsive, lying supine. Pulse is 50. Respiration is 24 and shallow. What do you do? What do you do first is another way of saying this. So now, rapid transport to a level 1 trauma center. Where does that go on here? Okay, very, very bottom. Okay. Now, initiate ventilations at a rate of 1 breath every 3 seconds. It's 3 seconds. Okay. So is that's over here under B, right? Okay. Now, completing a detailed physical exam. When do we do that? After ABCs, after treatment and transport. So that's way down here, right? Okay. And D, initiate a large bore IV and administer a fluid challenge. When do we do that? That's way down here as well, right? So I have from top to bottom, I have B, A, C, and D. Does that make sense? Well, what comes highest on this list? B, assisting this ventilation. Now, question.
But it's wrong.
Okay, initiated ventilation at a rate of 1 breath every 3 seconds.
He's 55.
He's 55, not a child.
He's not a ped, right? Okay, so here's my question to you guys. Is that the correct answer?
Nope, throw it out.
So I can go ahead and I can cross B out. So that leaves me with A, rapid transport to a level 1 trauma center.
Trick you, then
Oh,
you
yeah.
second guess yourself.
Correct. This is a question that makes you, this is a question that contradicts itself.
Because instantly you see shallow, and you see the shape of ventilation.
Yep, so treatment priorities for this patient should include what? Rapid transport to a trauma center. Does that make sense? Now, 20, 30 questions later, you're going to get asked a different question. It's going to do this exact same buildup, and it's going to say, this patient's clinical presentation is most suggestive of what? Increased ICP. Now, but whenever I look at it at that time, 55-year-old male, altered level during a domestic dispute. Unresponsive, blood pressure 170 over 100, pulse is 50, respiration is 24 and shallow. That is going to tell me increased ICP. Okay, and that is going to be my answer. And then you can get asked another question, same exact way. What clinical manifestation is your patient presenting with? Cushing's triad. Does that make sense? So let's look at this next one.
Guys, if y'all don't understand how he's breaking this down, eliminating it, or making this happen, speak up. It's your opportunity to apply it one-on-one to make sure you have the skills to test, okay?
So at any point, ask a question.
You
Okay.
guys see what we're talking about how to test?
Yes.
It's got less to do with what you know and how you think it through and apply it to your next question requirement.
Yes. Now, this next one, all right? Take your time with it, okay? You're dispatched to a 24-year-old male patient complaining of difficulty in breathing. Your patient states that his signs and symptoms develop suddenly while jogging. The patient presents in tripod position, respiration is 26, blood pressure 92 over 64, pulse is 100 with angioedema. Which of the following is most important in the management of this patient? What is the question asking us?
What you're gonna do to help him.
What am I going to do that's going to help him the most? Okay, that's what the question's asking us. Now let's look back at it. 24-year-old male, difficulty breathing, suddenly while jogging. He's in tripod, elevated respiratory rate at 26, blood pressure is 92 over 64, pulse is 100 with angioedema. What are we going to do? Okay, that's what it's asking you. What is going to be most beneficial? Am I going to assist the patient with his meter dose inhaler? I don't want anybody to talk. I just want you to, after I read these out, I want you to raise your hand. Am I going to assist the patient with his meter dose inhaler? Assist the patient with the EpiPen injector? Administer high flow oxygen? Okay, so raise your hand if you think we're going to assist him with his meter dose inhaler. Okay, raise your hand if you think we're going to assist him with his EpiPen. Raise your hand if you think it's administer high flow oxygen. Okay, now, so here's my question to you guys.
It doesn't tell us is this what he's stating.
It doesn't, because it's not important. Doesn't matter.
Still in tripod position.
He's in tripod position, and he's got an elevated respiratory rate. Does that make sense? It is only going to give you just enough information to answer the question every single time. And see, what you just did, that's the trap that a lot of people fall into. They're like, I don't have enough information to answer this question. You have just enough information. Promise you. Okay? Now, so, what is this guy's issue? Can anybody tell me? Asthma. Okay. Anybody else? Could be allergic reaction. So I have two different modalities. I have two different directions that I can take this with. I can take the asthma pathway, or I can take the anaphylaxis pathway. And the anaphylaxis pathway is going to be correct. Reason being is because he's presenting with angioedema.
But you don't know what's causing that.
Correct. We don't know what's causing that, but is it asthma?
You don't asthma,
Does that make sense? So angioedema. Angioedema is swelling of the face, tongue, and neck. Does that make sense? Okay. Now, which of the following is most important in the management of this patient?
Wouldn't it be the EpiPen because he wouldn't, the oxygen, he can't get any oxygen. His airway's closing.
So his airway is closing, yes. What is an EpiPen going to do? It's going to decrease the swelling. So is it going to allow him to breathe? Is it going to lower that respiratory rate? Does that make sense? Does he need oxygen? If it says, what should you do first? Oxygen. What is the most important in the management of this patient? EpiPen. Reason for that is because the EpiPen is going to solve the root issue. Does that make sense? Yeah. Did you pick EpiPen?
Yeah.
Then yes,
21.
you're correct. Okay.
Oh, whatever.
So
That's gonna make you like,
now, but looking at it and understanding, what was the question asking us? What's going to save his life? Is oxygen going to save his life? It's going to prolong it. Okay, it's not going to save it. Does that make sense? And that is how you have to look at these questions. Now, if I would have said what should be done first, oxygen every time. Okay, if I had these three answers, we all tracking with that? Any questions about this? Next one. You're dispatched to a local residence with police officers to a 19-year-old female patient involved in an assault. Your patient presents unresponsive with a blood pressure of 100/64, pulse is 100, respiration is 32 and shallow with an evisceration protruding through the abdominal wall. You should. What is this asking you? What you should do, and who are you? What are you acting as? Your highest level training. So if you're taking your basic registry, what are you acting as? Who are you? A basic EMT. If you're taking your advanced registry, who are you? An advanced EMT. Does that make sense? Okay. Now we have to reread it, figure out what's important. Dispatch to a 19-year-old female, assault, unresponsive, pulse is 100/64. Do I care about that?
No,
Do I care that her pulse is 100?
not really.
Do I care that her respiration is 32 and shallow?
Yes.
Okay. And do I care about the evisceration?
Yeah.
Okay. I have a dispatch to a 19-year-old female in an assault, breathing 32 times a minute with an evisceration. What do you do? Okay. Now, so we're going to do the same thing. Okay. So, cover the evisceration with an occlusive dressing. Is that important? Eventually. So it's going to go down, way down there at the bottom. Cover the patient to prevent heat loss. When do we do that? Circulation. Okay. So B is going to go right there. Initiate ventilation at one breath every 8 seconds. Okay. So it's airways, but it's wrong. So I'm going to go ahead and put it up there. And I'm going to cross it out. Rapidly transport to a trauma center. So,
Before the covering.
right. So now if we look at this, we see C, B, D, and then A is way down there at the bottom, right? Okay, so C, that's highest up. Initiate ventilation at one breath every 8 seconds. Did it contradict itself?
Yes.
So it's automatically out. B, cover the patient to prevent heat loss. That's right there under circulation. And then rapid transport to a trauma center. Just right below it. Does that make sense? So when you get asked this question, you're dispatched to a 19-year-old female in an assault, breathing 32 times a minute and shallow with an evisceration. What should you do? And your answer is going to be what? Cover to prevent heat loss. Does that make sense? And I promise you, you are going to get it right every single time that you do this. Okay? We're going to talk about this. Okay. So, all right. So, right. All right. Now,
Give them a taste of paramedic school.
all right. So, look at this right quick. Oh, where'd it go? Okay. The renin-angiotensin-aldosterone system is best described as A/AN. Now, if you get asked a question like this, now, okay, so real talk for a second. You guys could have this exact question pop up on registry. Okay? Now, can anybody tell me what the renin-angiotensin-aldosterone system is? Something about the kidneys? Okay. But yes, no. Now,
Yeah, do a blood pressure.
do a blood pressure.
Kidneys.
Yes. So I know that it has to deal with blood pressure and kidneys. Knowing that, So is it intrinsic hormonal compensatory mechanism that helps arterial blood pressure? Eh,
I'm gonna go yes.
okay. So if you don't know anything about it, try to look at the words.
What's that extrinsic?
Yes. And intrinsic versus extrinsic. Yes. So if you're dealing with hormones, it's going to be intrinsic. And if we're pooping it out, it's extrinsic. Does that make sense? Small way of looking at it. Okay. Now, but anytime you do this, narrow it down 50-50. Okay? Compensatory mechanisms that increases arterial blood pressure through the stimulation of epinephrine released from the kidneys.
Yes.
I like that.
Okay. That would be my answer.
Where is the answer?
Well, Jeremy said it's his answers, right?
I said it first, so you got
Right. I'm sorry. Great minds think alike, and I'm just following in your shadow. I apologize.
You're not supposed
I said it.
Just be careful walking out the door. It's okay. All right. So you have to remember, you have to know what the question's asking, mark through those distractors, okay? Be able to tell what's relevant and what's not. Look for those differentials and those vital signs to guide your treatment priorities, okay? And then mark through answers that contradict themselves. One breath every 3 seconds. One in an adult. One breath every 8 seconds, okay? It's completely contradicting. So how we feel? Better? Okay, now, so real question, guys. Have I kind of like shown you guys a couple different things that are change the way that you guys are looking at the test and everything? Is it, you guys going to start like using this whenever you test and everything?
I think so.
You think so? Lula.
Pass basic without using that already.
Do what?
I don't know how you could have passed basic without using that already.
Well, I mean, on basic,
I just do it in my
I
head.
let out the
Right.
stupid information, but I didn't like level or
Break it down that
break
far.
it down.
Yeah.
to the-
And see, that's okay. But the thing is
You wanna
As-
know the honest answer?
as long as you give it your best effort.
Public school today in this state doesn't teach you.
Yeah, this is,
You're not taught critical thinking in school today.
no.
I feel like this should be like a class.
Should be.
Yeah.
School.
Mhm.
Whereas a lot of people did not learn like that because they didn't have to.
I don't mean to.
Some people have the
education.
natural
I
ability to
analyzed
do
in
this.
junior.
Right.
But
That's-
some people don't. It is something that can be taught.
Mhm.
Never had.
Yeah, I mean, and it makes a difference.
There you go.
All
Learn the right way, learn the hard way.
exactly. Now, there's something else that you guys need to do whenever you ask a question, because this method right here, it works whenever there's a scenario, correct? Okay, but what if there's not a scenario? All right, what you have to do is, how did I tell you guys that every question is going to be built? Or A, B, C, D, multiple choice, right? Okay, so we know that A, B, C, D. So what I do, and I do this exact same thing, I promise you, I'm not blowing smoke up at you, nothing like that. So you got A, B, C, and D. I write this out on my paper, okay? I know that if I leave it, if I just straight up guess and I have 4 answers, what's my chances of getting it right? 25. And if I break it down to 3, 33. And if I break it down to 2, 50. And if I know that it's 1, I got a 100% chance of getting it right every single time. If you don't know, narrow it down, do this method, okay? And I use this method frequently. You don't have to use it for every question. But if you do find yourself in a situation where you need to use it for every question, that's totally okay. Don't let that bring you down. Thing is if you look at A, look at it, yes, no, or maybe. Look at the question, figure out what it's asking you, read your answers. As soon as you get to A, yes, no, or maybe. Your very first initial one, okay? And so if that answer is no, I'm going to cross an X in that. And so I know that I need to focus on B, C, and D. Now, if I get to B and I said, maybe, and I get to C, the answer is yes. Yes, that's definitely my answer. And I get to D and I said no. What does that leave me between? B and C. I have a maybe and then I have a yes. Now, Go back, look at that question again, read it again. Is there anything that's going to turn your maybe to a yes and your yes to a no? Does that make sense?
You gotta make sure, guys, that the whole answer is correct.
Correct.
If part of it's wrong, it's wrong.
Yes. Just like those initiating those ventilations. Okay. Now, but the other thing is you have to make sure that you do not click it. Because as soon as you click it, as soon as you click your answer, you are mentally checked out onto the next question. Do not circle something and then try to erase it on a written test. Do not click it on the computer-based exam and then try to click the next one. If you're stuck between B and C, don't click B and then click B and then click C, because you're mentally, you're already gone. You're checked out. Does that make sense?
Guys, how I like to teach my students to take a Scantron test, not computerized, but one on an actual piece of paper. I tell them take a scratch sheet of paper, and anything they don't know 100%, they write those numbers down. That's like when me and you went through paramedic school. This is how I took every single one of those tests.
Yep.
If I didn't know something 100%, I wrote the number down. And then after I went through the entire test, I went back to my sheet, referring to each one I was not unsure of, and I took a little bit more time with those and really had to break them down. The ones I knew quickly, I answered. But the ones I needed to do a little work on, I put down in a separate column. Okay?
And on the basic exam and the paramedic exam, you can't do that because they're adaptive.
Yeah.
However, the advanced exam is not adaptive. It's a flat 135 questions, 135 questions at 135 minutes, and you can flag your answers. You can flag every single question if you want to. It's going to be a little tedious going back and not running out of time, but
On computerized tests now, I would not advise going back at all.
Yeah.
If once you pass a question, you need to leave that thing behind you.
Yeah.
But on written tests, it's just
You
a
can
little
look at it.
story. Yeah.
So 135 questions, 135 minutes. That's what you got. If you allow yourself 1 minute per question, using this is going to help you. And we're going to come back to this here in just a minute.
Don't ever think, guys, that you can bank time. You can't bank time. Because you're going to get caught on a question that just hangs you up. And if you're more worried about the time than you are answering the question, your head's not going to be in the right place to answer that question.
Right. Now, occasional later questions will provide answers to the previous questions. It's totally true. Okay. Sometimes you might get a question three questions down from where you just were, and it's like, oh yeah, that just answered that question. I went back there. On your advanced test, you can go back to it because it jogs some section you remember. But on your basic test, you can't do that.
If you flag it.
If you flag it. Now, potentially check your watch. Make sure you're moving along in a timely fashion. How long do you allow yourself? Can't have a watch. You're correct, but you do have a timer on there.
Yeah.
1 minute per question. That's it. Okay, you should spend an average of 1 minute per question. If you finish a question in 15 seconds, great. That's going to allow you a little bit extra time for another question, because you're going to have some questions that you're going to go through.
Just like I said.
Yeah. Now skip the hard questions, the ones you're unsure of, which is exactly what Kip was saying. Okay? And make sure you're answering the same question on the answer sheet as you are on the test. On the written side, on the Scantron, that's incredibly important, because if you get one key off on your Scantron, you just jack the whole thing. Okay? On the computerized exam, it's not going to be like that.
Just one question
There's
at a time.
one question at a time. Avoid making eraser marks. Now with multiple choice or very difficult questions, eliminate the wrong answers first. That goes back to what I was saying about yes, no, and maybe on every single question. Okay, and this may leave only one correct answer in most circumstances. And beware of questions with the words except or not. If you have except or not at the end of your question, you're going to have 3 right answers and 1 wrong answer. So you're going to, because especially if you miss the word except or you miss the word not. So for example, if I tell you that somebody with difficulty breathing is going to present with all the signs and symptoms, and you just skip over the word except. So somebody with signs and symptoms of difficulty breathing, could they present with tripoding? Okay, so I'm going to leave that. That's a yes, right? And then they're going to present with, tripoding. And then you have accessory muscle usage. Are they going to present with that with difficulty breathing? Okay. Is somebody going to present with non-labored breathing? Oh, that's weird. Why is that even there? That's a wrong answer. Okay. And then I have D. And then it says, oh, well, they're going to present with irregular or an irregular respiratory pattern. Is that signs of adequate breathing? No. So I have 3 right answers, right? And I have 1 wrong answer. You're like, how do I pick the best of the right answers? Well, go back, read your question again. It says accept or not.
Usually the one that sticks out, and if you can find something that relates with the other 3, then the one that's sticking out standing alone is probably going to be the right answer.
Right. And Thomas, what was that you were saying earlier about the complex question, complex answer? Is that that's what you said, right?
Yeah, typically if you've got a question that seems really complex and you have 3 very quick answers and then you've got 1 complex answer, it's not always, but usually it's that really complex answer. Whereas if it's a simple question, rarely will it have a large answer. Like for example, the paramedic question you put up there.
Yep.
You actually read through the question, you know, it has this big complex issue. And when you looked at all those answers, they all were fairly complex, but the right one, which was the last one, was more complex and detailed.
Does that make sense? A complex question is going to require a complex answer. A simple question is going to require a simple answer. Every single time. Okay?
Something else that
Yes.
Amanda used to talk about, say if going back to that complex versus simple, but now you're talking general versus specific.
General versus specific, yes.
Were you all going to get into that?
I was, yes, but go ahead.
Well, no, I was just gonna say, and I'll ask you a question. If you have a pediatric patient, you should, with difficulty breathing or something, you should expect this. It's gonna be a general answer.
Right.
If it says you have a 1-year-old patient, you should expect this. You're going to narrow down your vital signs and your assessment down to that 1-year-old. But if it's pediatric, you could have a broad range. So
Right. From 0 to 18. So is that what she said? Does that make sense? If it's general versus specific. Now look for similarities with 2 or more distractors that would help you rule out these choices. Okay, we put that into practice there a minute ago. And when you finish, review, especially if it's a Scantron, make sure that you've done it all. You haven't answered the same question twice.
It's fantastic.
did you steal that?
Yes. Now, so the computers. Yes. All right. So the exam is computer-based, categories tested, and it's based off an algorithm. Okay. There's a science behind it, behind how you're going to test.
Don't try to figure it out, guys.
And so the way that we've designed our exams here is going to kind of based off how you're going to see things in registry. That way we're building up a familiarity with it. Now, computer adaptive testing, or CAT. So what you have is going to...
Guys, this is where you go back to thinking that if you go with the mentality that if you make a 70% on these things that you're going to pass it, you got to understand when it comes to adaptive testing that you have no idea how they are grouping these categories together. You have to make a 70 on every category. And one can contain all the categories. You don't know. Or it might contain 2 of them. So you have to go with the mentality, I'm going to get every single question right. If you go in thinking I can miss a few, well, you're going to miss a whole lot more than that. All right? You might be missing multiple categories when you don't know it.
Okay.
And advanced the same way. So you just can't go around thinking that way. On my advanced, I had 1 OB question. 1. What would have happened if I would have missed that question? I probably could have failed the test because I would have failed that category. You know what I mean? So you got to go in. Yeah. But I mean, you got to go in with that mentality that, you know, I'm not going to assume they're going to be 20 questions per category and I can miss 5 of each, you know, or anything like that. You got to say, well, I'm not going to miss anything.
Now, you guys remember that Bloom's taxonomy thing that I pulled up there? That was that pyramid that started with a very basic knowledge. Hey, so what sound does the letter A make? Okay, so that's how these computer adaptive testing. This is how they work. They level their questions. So you have 5 different levels. They have a level 1 question, level 2 question, level 3 question, level 4 question, level 5 question, Level 5 questions, those are going to be your most difficult questions. Level 1, so what is the purpose of the heart? To push blood around and around. Okay, this is very, very simple ones. Okay, and now you also need to know we have a lot of different categories. Okay, so we have ops, we have medical, which includes respiratory, or I'm sorry, it doesn't include respiratory, it includes neurology and all that. And then you have respiratory, cardio, and you got trauma. Okay, so now the way this works is it's going to ask you a question. It's going to ask you a question about triage. Where does that fit under here? Fits under operations. Now, this very first question it asks you is going to be very general, okay? And so you get your question right. It is a green question and you get it right. Okay, so it knows that you have a base foundation there. It's going to ask you another question a little bit later on. Okay, and you get that one right. And so what it's going to do is it's going to bump up your yeah. I know. Okay, so now you get that one right. A couple questions later, it asks you a level 4 question, and you get that one wrong. Okay, so then it's going to bump you back down to that level 3, and you get that one wrong. And then you get your level 2 question right.
Next struggle.
Does that make sense? You need to maintain an average of that line. And that's just for operations. Then it gets into trauma. It's going to ask you a very specific trauma question. You get it right. And then you get, a couple questions later, you get it wrong. And then you get your level 2 question wrong. And then it asks you, what is the purpose of blood? Okay, well, to carry nutrients and oxygen and stuff. Okay, cool. So you get that one right. You get your level 1 question right. You get your level 2 question right. And then you get your level 3 question wrong. Level 3 question wrong. Level 2 question right. Level 2 question right. Are you maintaining at that average? So are you going to pass trauma?
They're trying to make sure that you getting that general knowledge question correct is not a fluke.
Right.
That's what they're going to try to do. Okay?
And then, so like let's say you're a wizard at cardio. You get it right. You get it right. You get it right. You get it right. You get a level 5 question. You get it right. And then you miss your next one and you're wrong. But you maintain all those other cardio questions and you maintain
So it's
above
not
that
like
average.
a sign if your test is getting harder.
Yes.
Yes.
That means you're
You're
bumping
doing
up.
well.
But don't sit there and
Don't try to figure it out.
don't try to figure out what question you're on. If it's a trauma question or cardio or this, because it could be a really long question, have one little bitty piece in it that is cardio, but the whole question is trauma. They might count it as cardio.
Correct. And so then at that point,
This
So-
is where your understanding of the material, if you go in with like a strong understanding of something, it's going to show on there. If you have a whole lot of gray area is going to kill you. Okay?
and
So
so
it's going to show on here.
they'll combine questions
Yes.
and they'll say, oh, this is a cardio and a respiratory question.
Mm-hmm.
Does that make sense? And
You
that's,
ask the same question both times.
yes.
I got asked. So
You're probably writing the line on it.
it was the same exact thing.
Well, you passed, so you answered it
I'm going to count it as a win.
correct.
All right, guys, also remember this. They run tests, they run
Filler
physics
questions.
tests through there also. In other words, registry throws in questions that's not even related to your certification. That may just be for research. They pull a lot of data on the backside, so you may have got the same question over and over and over, just as a fluke, or it could be.
They want to see
Blood
the
pressure
question.
was
So.
like 2 different. I was literally starting to count them. At the time, I got 12 placenta. It was the answer was placenta previa.
That's the reason, like what Jay just said, don't read too much into why you're being asked what you're being asked, because it may legitimately be just a crap question. It may be a test question they're considering to use in the future. It may be a research question,
Mhm.
or, I mean, it could even just
See
be,
if you
I
can
mean,
start second guessing yourself.
Yeah,
Right.
Because I was like after the 6th or 7th time, I was like, dude, do I even know what I'm talking about? As I said, I literally looked at the computer. Do I even know what I'm talking about?
it Might just be the luck of the draw. You never know.
Absolutely. But as long as you maintain consistency in your answers, because then if you consistently get it wrong and you come back here and you talk to us about it and you're like, well, these are my answers and I click placenta previa every time, but this is why I clicked it and you were right every single time, I can verify that for you. Or if you're wrong and you talk about it and you're like, well, was it painful? Was it a tearing sensation? Well, it likely wasn't previa. It was likely abruptio.
Well, the same
So-
thing. I had a burn question, the same burn question, asked like 5 different ways to me. And when I took my patient, all right, that's with the same thing came around every time. How do you treat this? Dry steroid dressing. And I stuck to my gun every single time.
I think I got asked like 10 epinephrine questions
Right.
on my paramedic one.
So
And then I come in, like, what?
it's not a fluke.
Yeah. So whenever I got out of my paramedic exam, I called Bryce, which is my instructor, and I apologized for embarrassing him. But I passed.
Well, after my
I remember
basic,
that. I remember that phone call.
Yeah.
I was sitting there with him.
And then I passed.
So yeah, no, it's a true story. Now, there's a couple different types of questions that you have. You have rote memory questions. Either these are going to be the ones either you know it or you don't. If you don't know it, there ain't nothing that's going to be like the renin-angiotensin-aldosterone system. Either you know it or you don't.
Yes.
Okay. Easy peasy. Okay. So what receptors does epinephrine work on? Alpha beta. Okay. Or the adrenergic. Okay. Now backwards questions. These are questions that's going to give you a problem and it's going to expect you to work backwards. Why does this patient present with pulmonary edema? Or why is this patient presenting with pedal edema?
Well,
Work your way backwards. Why is there blood in their feet? Because it's backed up in their vena cava. Backed up in the vena cava because the right atrium, because the right ventricle. Does that make sense? Maybe because they have pulmonary hypertension, because they have COPD. Okay? So now, procedure treatment. So these procedure treatment questions, what they're going to do is they're going to say, there's going to be like what was on the other side of that board. What's going to come first? What is going to be most beneficial? Like our EpiPen versus oxygen a minute ago. Okay? That's a procedure and a treatment, a directional question. And it's also going to ask you, so it's going to give you two different directions. Like that EpiPen question, he thought it was asthma, which, while jogging, that is a very logical thought process. But if you look at that angioedema, because it's going to tell you, it's going to say congestive heart failure versus COPD, anaphylaxis versus asthma. Okay. Correct.
sure.
Don't know what angioedema is, then you just found yourself in the trap. Okay. And then you have general versus specific. A general question is going to be what is diabetes? Okay.
What's the rate for 2-person CPR?
What's the rate for 2-person CPR? That's it. Now, very specific. What is the treatment for DKA? What does D50 do? It's very, very specific. Okay. Now, the way that you choose the answer that's most correct is by doing those techniques that we showed. And so if you got a math problem, you see 4 pencils and 7 apples, how many pancakes will fit on the roof? Purple, because aliens don't wear hats.
Exactly.
Yes.
Yep.
Now,
Big Jackson.
what time is it? 11.
52. GCS, yep.
Yes.
All right. Each one of these things is something that you got to know.
You can't make these up.
If you don't know it, you're wrong. Okay? Because if you get asked a question on any of these things and you don't know it,
You ain't got no way to get through it.
you're not going to be able to get it right at all. And this can be incorporated in all of those categories because you have to be able to calculate a GCS in every single one of those categories. You have to be able to calculate an APGAR. You have to be able to calculate the Rule 9s, berms,
Drip set.
drip sets,
How to come up
drip
with
rates.
Drips per minute, yeah.
Okay?
Drugs, yeah.
Oh, drugs, yeah. Absolutely drugs.
And too, guys, going like when you're taking your basic test too, because we start teaching advanced from day one, and there's a reason for that because you can run into some advanced questions on basic, like.
And that's what I was getting
nitro
to
is a big one that they love to ask.
about knowing the job of the person above you, right? So let's get into that. So just be sure to read out the question, read the question again, and pull out those keywords, pull out that key pieces of information, and then read every answer completely, like one breath every 8 seconds. We know that's wrong. Read the question again after you've gotten all that, and throw out your answers. Look at your answers and say yes, no, and maybe. And then based off of that, narrowing it down to at least 50-50, throw out your best answer out of the ones that's left. Okay? So do we have any questions?